you need to first understand what are the corporate objectives for an obesity management program. And remember the assessment, intervention, monitoring, evaluation framework, AIME. Do an assessment first, get the BMIs from the latest health screening exercise, launch a survey to determine lifestyle habits. After you have some baseline data, you can define your target audience. Then conduct a needs analysis. What do your target audience need? Find out through focus groups, informal conversations. Usually, you will not only want to initiate weight loss, but also equip participants with skills to maintain the weight loss. Most programs last 6 to 12 months, and these are some targets we counsel the participants to aim for: a 0.5 to 1 kilogram weight loss per week. For a holistic program, you can consider interventions at the intra-interpersonal level as well as the organizational level. So at the intra and interpersonal level, we're looking to educate the employee. How do you make the employee self-efficacious at performing the healthier behaviors and maintaining them? So we also teach the participants very important topics such as how many calories do different types of food contain, what are the nutritional content, how to make better food choices. And then, usually the employees will say, there's so many things against me leading a healthier lifestyle. I have no time. And then we question those barriers, the barriers to improving their lifestyle. We challenge the perceptions. Really, can you just take 30 minutes, maybe after work, for yourself at the gym? Motivation is important. We also identify what helps the employee achieve healthier behaviors and use that as a tool to encourage the achievement of their goals. So is it wanting to look better, or is it getting healthier for the family? For self-efficacy, developing the know-how for positive behaviors, and if they're unsure, where can they find resources to help themselves? So this is important to sustain the behavior change, because the aim of this program is not to teach everything about weight loss, but is to equip the individual with skills to initiate and maintain the positive behavioral change. So for incentives, we get the individual to identify milestones in their weight loss journey and reward themselves for reaching those milestones. So this is an example of health talks you can conduct at the workplace. Some of the topics that you can cover in the educational piece of your program to enhance skills at the individual level. So I spoke about organizational level interventions, and so these are some of the things you can consider: classroom-based workshops or cooking demonstrations, supermarket food tours where a nutritionist brings employees around to teach them how to read food labels. For physical activities in the workplace, do note that you're likely to get big groups of 60 to 100 participants, and you should categorize them by fitness level so that the exercises are customized and you don't find a huge dropout rate because the activities are too difficult for me, or another group says it's too easy for them. So again, these are some types of physical activity programs that the company can offer. Okay, so I also wanted to touch on environmental modifications, which are important in the workplace. Okay, so these are some things that you may want to try: stocking your vending machines with healthier options, offering healthier meals like fresh fruits and vegetables at your cafeteria, and pricing non-nutritious options at a higher cost to encourage the consumption of healthier choices. Okay? We can also ensure that space, facilities, and equipment are adequate to support employees who want to bring their own healthier meals to work. Okay? So for physical activity, we can post motivational signs near elevators to encourage employees to take the stairs instead. Okay? And on-site infrastructure such as a gym or even a walking trail can encourage physical activity. So lastly, don't forget policies, which should really be in sync with your program initiatives. Okay? So for example, propagating standing or walk and talk meetings. Okay? And improving your employee benefits to, subsidize gym enrollment. Okay, I talked about evaluation earlier. So why evaluate? Because we want to avoid mistakes in our program and want to repeat the successes. Without evaluation, there's no improvement And I think importantly is to justify the use of resources of the company on this program, especially to senior management. So how do you evaluate? Going from right to left, okay, you want to see that your program has aligned to the goals, impact, and process objectives that you have set. So if your goal is to reduce BMI for your target group, then you want to measure the before and after BMI. You also want to measure the before-after cholesterol levels, hypertension rates, and diabetes rates. So impact objectives. Changes has the program made to the health practices of employees? Has their buying or eating behavior changed? Are they choosing healthier foods? So for process objectives, was the program well managed? How many employees participated in the program? What was their qualitative feedback? So to conclude, I think we have talked about how there is a clear business case for workplace health promotion programs. It's important to understand corporate objectives for health promotion because they contribute to effective program design and overall program sustainability. Understanding the national landscape is important because it helps with resourcing, prioritizing your health promotion efforts, and enhancing corporate image. An integrated approach is necessary to promote both workplace health as well as safety, and a framework like assessment, intervention, monitoring, and evaluation may be useful for systematic design, implementation, and evaluation of these programs. And with that, thank you very, very much.
Thanks, Dr. Alicia. You've given very good knowledge, insight about this health promotion. And I personally very interested in some of the examples which you have given, especially on the taxi drivers, where both of them go for the medical examination at the same time, taxi and being the taxi drivers as well. I mean, these are some of the very nice examples that I think we all can learn from your experience and all that. Thanks again. So, ladies and gentlemen, right, we now commence on our Q&A and discussion session. Please be free to ask a question via the QA button at the bottom of your screen, right? In between, we will also be displaying some polling questions at the start of the discussion. Please do vote. So before we start on the discussion on that, I would like to welcome our panelists who will be joining Dr. Alicia, Dr. Yamamoto, and myself. Yeah, allow me to introduce the panelists, right? Dr. Sunil Ketapal, the Director for Association of Healthcare Providers India. Associate Professor Pham Lee An, the Vice Chairman for Vietnam Association of Family Medicine. Dr. Peter Pang, Oncology and Emergency Specialist from Precious Blood Hospital, Hong Kong, China. Dr. Suhairul Sazali, a Family Medicine Specialist and Occupational Health Doctor from Arau Health Clinic, Perlis, Malaysia. And Dr. Anna Sofia Victoria Fajardo, President for the Philippines College of Occupational Medicine. Welcome all.
Yeah, welcome.
Yes, welcome.
All right, thanks. Okay, so before we go into the Q&A and the discussion, let's do some polling question here. The first one. Which factor do you believe presents the greatest barrier to effectively prevent and manage workplace-related diseases in your organization? Lack of resources, insufficient employee training and awareness, resistance to change or implementation of new policies, or inadequate support from management? Please vote. Okay, can we see the results? Okay, I think they are equally, you can see it's almost like quarter of them have all the problems, barriers in their workplace, almost 20 to 25, 27%. They have. Which of the following workplace-related diseases do you believe pose the greatest challenge to your organization? respiratory illness, musculoskeletal disorders, skin conditions, infectious diseases. Please vote. Okay, can we have the results? All right. Oh, a big majority of the participants have answered the musculoskeletal disorders. So these are the ones like what our earlier, the first speaker, Dr. Yamamoto, have mentioned, the common occupational diseases, right? So musculoskeletal is one of them. 59% of them have musculoskeletals. I think this is actually the real scenario in any workplace. Thank you very much for the polling question. So let's move into the Q&A sessions. Right, so the speakers and these panelists, I hope you are ready. I have a question. This is for Dr. Yamamoto and Dr. Fajadu. This is about the clinicians in Philippines. Is workplace musculoskeletal diseases is recognized as a clinical diagnosis? Can it be used for medical reports, at least locally in the Philippines? Not only for charting purposes, but as well as for filing patients' paper for legal purposes.
Okay, so workplace musculoskeletal disorder, unfortunately, is not exactly a diagnosis. Commonly, what is seen in the Philippines is like low back pain, sciatica, this kind of things. So technically, what happens is when you do a report, it has to be written like secondary to the workplace area, rather than having or writing the whole workplace musculoskeletal disorder. From there, from what I understand, especially when we get into the statistics, the Department of Labor gets it from our annual medical reports. So this is where we get the counts in terms of statistics of the occurrence of workplace musculoskeletal disorder.
In addition,
Dr. Fajadu, you want to add on that?
yes, I hope you can hear me well.
Yes.
So in addition to what Dr. Yamamoto mentioned, musculoskeletal disorders may not be specifically a diagnosis on a workplace musculoskeletal disorder, but you may actually place this or submit this to the Employees Compensation Commission for to be compensated as a workplace related disorder. So if the patient is actually after a compensation from our government, so they are able to submit this to the respective government agencies such as the SSS for the private sector or the GSIS for the government sector. And then it will be the Employees Compensation Commission to approve or disapprove if it can be compensated as a workplace related disorder.
All right. Okay, I think that answered the question from the participants from Philippines. Thank you, both of you. All right, there's a question from a participant who's from India, Dr. Ketapa. How can one help employees who feel bullied at work? So this must be bullying at work, right? Example, in a production line, the operator is chased to reach a certain number of products to be produced at a given time by the line leader or the team leader or the supervisors, and they can't find it conducive to chat with the supervisor at the work in fear of being, highlighted in the next meeting for termination or that. Okay, so how do you advise this group of people where they feel they've been bullied at work?
Yes, Gugilan, thank you for asking this question. And Basically, bullying at work is a very, very common problem where you find the seniors or the managers or the supervisors bullying their subordinates. And somebody who is not comfortable with his or her senior or manager, definitely he will not be able to approach him or her for any problem. So I think if first of all we need to understand, the employee need to understand, if he is giving you some task or some work and he wants to meet you the deadline, because the question here is he is giving the employee a deadline, the products to be produced at a given time. So that deadline also is important if you see from the manager perspective. But if he or she does not able to meet the deadline or feel that it will not be able to do it on time, so I think the communication channel has to be open, one-to-one. This is very, very important. But if they are not comfortable, they may go to, because any grievance handling mechanism in any organization, if your superior you are not comfortable with, then you need to go to a higher level. That hierarchy, because otherwise the problem will never be solved. It is basically communicating with your senior. First, try to communicate to him or her, to the manager, that what you feel about this problem. If he is not able to take any action, or if still you feel bullied, then you may go to higher level, right? And talk to the higher management. So then they all can come to be together and discuss. So I think most importantly, one-to-one, try to have it solve it with one-to-one communication with the manager. Otherwise, escalate the grievance. So that's how I would advise.
Thank you, Dr. Ketapal. I think this issue is not just particularly in India. I think every workplace around the world, we have these issues.
Yeah,
Bullying in
absolutely.
workplace, all that.
It is very common. Yeah, in India also, it is very, very common everywhere. Very
Yes.
true.
So is there anyone else who have encountered such case, or you have to manage bullying in workplace, probably from the panelists or the speaker? Maybe a word from you.
Yeah, maybe I'll chip in here.
Yes, Dr.
I guess the overarching theme is psychological safety, right? How do you ensure psychological safety at work for your employees to be able to speak up without fear of repercussion, right? So generally speaking, I think Dr. Sunil has pointed out a very important factor will be having somewhat of a flat hierarchy where it comes to managing employee feedback and complaints. He talks about the worker being able to go beyond his supervisor to give that feedback. So that's one of it. Number two, I think training is very important. Training for your supervisors, those at managerial level. I think skills like active listening and being open to feedback, having a growth mindset, these are all very important skills that you would want your manager or your supervisors to be able to pick up. Overall, the last thing I wanted to say is that an open culture within the workplace is generally supportive of employees speaking up. And I think, the senior management from a lot of international companies have come to recognize that finding out, hearing from the employees direct, sometimes gives them good insight into the weaker parts of their organization. For example, is there processes that are particularly hazardous or particularly stressful in the way work is organized within that, that work task that has to be looked at. So they have actually found value in having employees speak up, and raising their feedback. Yeah. So just to add on, psychological safety at work.
Thanks, Dr. Alicia. I think very well explained. Yeah, sure, Dr.
Okay.
So,
I encounter few, I think a lot of case.
Bullying in workplace.
Bullying, yes, occupation is not happening in the factory. Also in our health setting, also been because we see this case every time, right? So what is that we can do is to be as mentioned by Dr. Alicia Tan, the superiors or the top manager must be open-minded on this kind of problem, because it will lead into definitely mental health problem, or can be lead into diseases, and definitely absenteeism and also presenteeism will be happen right now, right? So this is one of the thing. And second is MDT approach lah, so multidisciplinary team. So if this kind of things happen, so we need to tackle as per multidisciplinary. It's not about the employer, but must be into with the doctors also. Supposed to be like psychiatrists, or can be into the family medicine specialists, or OHT itself can be in place.
Yep. So I think since now we have a lot of general practitioners, the primary care physicians, I think now they can be part of this as well to help in this, to address this bullying in workplace. Yeah, Prof. Prof. Pang.
Yeah. Yeah, I think that's an interesting issue today. In Asian country, we deal with many challenges. For example, for occupational health, the first, we have a diversity of employee. For example, we have a white collar, farmer, labor, and some special case, for example, health provider, policeman, for example. For group, they have a different of the need for assessment. The second one, who will be responsibility for occupational health? Osmot in the country, public health people can responsibility for need assessment, for example. However, clinical side that belong to general practitioner or family physician, they are the main health providers. For example, the third one is the changing from you see in the world, we change from global health to One Health, and now planetary health. That means the climate change, they influence a lot to the occupational health. And based on three of them, we have the other challenges. For example, health illiteracy for our Asian people, cross culture. We changed from the Western employee to now to go to Asian employee. So different about the culture. And the third one is the leadership, you see. That means that we have to balance, to have another approaches with occupational health. I very impressive for two presentation that give us the framework. However, we need to adjust for our situation in Asia. Thank you.
Thank you, Prof. I think we have a lot of answers for that question. Since now we have many questions coming in, let's move on to the third question. This is for Dr. Alicia. You were asked whether you can give some additional tips how to encourage companies to subsidize gym enrollment. I think this is more the health education, health promotion, Dr. Alicia. And I think they feel that a lot of resistance against this additional expenditure. So probably you can share, Dr. Alicia.
Hi. Yeah. I think we are again back to my main point of first to find out what is the key corporate objective if they want to launch a health promotion program for physical activity, right? Because we're talking about gyms, right? And then once we understand that, we want to position our program to be able to meet that corporate objective. Okay, so for example, if you are a company that's involved or your employees are involved with a lot of manual handling, and then you see that you're getting work-related musculoskeletal diseases, okay, resistance training at the gym may contribute to less absenteeism and increase productivity. And then you sell this piece to management, right? That as part of your physical activity program, okay, access to a gym, maybe coaches there, expanding it to holding lunchtime sessions in Pilates, yoga will be beneficial to their corporate objective. Yeah,
Okay,
that's how I would do it. Thanks.
Thanks, Dr. Licia. I think it's the same thing, the concept which you already explained earlier in your presentation. Thanks. Right, let's move on. That's a question for Dr. Peter. Quite interesting. Let Dr. Pang answer this. How would you advise doctors who themselves smoke?
Sorry?
Very short question, but I think it will be a lengthy answer.
May you repeat your question again?
Yeah.
Sorry?
How would you advise doctors who themselves smoke? I think we have, that issues, right?
Oh, smoke.
Doctors.
Okay. In Hong Kong, our anti-smoke education now is quite good. And also when you buy a pack of cigarettes, it's quite expensive. The duty for buying a pack of cigarettes is so expensive now, less than 10% of our doctors will smoke. But you say how to advise our doctors who smoke. I think to me, I seldom encounter doctors in Hong Kong who smoke, and they know the consequence. So maybe may I change my your questions to one that I want to speak to your previous questions on productivity. May I?
Yes, Dr. Peter.
Yes. For your last topic on work, to advise the employee to speak up or on the productivity issue, one point I want to raise up is the working hours. We have a research done that if you work more than 55 hours a week, you are have 50% more to develop atrial fibrillation, AFib. On the other hand, in one recent research in Hong Kong, we have a figure of over 300 people who have passed away during the past 2 years with non-accident, but sudden death while they are working in Hong Kong, especially to work. They are the construction site workers and also the security. For the construction site workers, they are heavy workers. For the security, they have long duty hours and they have to do the night shift. So as regard to the comments by other panelists, just I heard, actually, for example, if you say that you are having a car for them to go to the gym, I think that does not apply to those heavy labor workers in the construction site, isn't it? But on the other hand, in Hong Kong, we have a heart-caring campaign, which is being done by the government and also the Occupational Health Department. And we have over thousands of companies who join this program. But the feedback is really, really poor. For the companies, they allow their employees, just as the panelists say, before they work, they gather together and do some detect you have high blood pressure or you have high blood sugar. And for your company, for your employer, you in your prevention rationale, you save your staff from developing chronic illness, and then you save your staff from having sick leave or going to see doctors, and you have to pay the insurance, medical cover, isn't it?
Yes.
But the problem is, for those staff you are picked up to have hypertension and high blood sugar, where do they go to see the doctors? We have public doctors and we have the private doctors. If you go them to queue up in our government, everybody knows in Hong Kong, our hospital authority, you have to wait 3 to 6 years for just a screening consultation.
Okay.
If you go to the private sector, then a lump sum of money, who's going to afford it? Is it going to be paid by the employer or going to be paid by the employee themselves? Finally, in Hong Kong, unlike Japan, in Hong Kong, for those 300 people who die during their work and is not due to any accident, for these 300 people who die at work, in Hong Kong, we don't have any legalization, any law for compensation. That is what I'm going to
Thank you, Dr. Peter.
express our people.
Thank you very much. In the interest of time, I have to skip some questions. Let me just jump something very, very important. Dr. Maria, what is the most common remedy to avoid the cervical spondylosis, which is very common in musculoskeletal disorder? I think this is very common everywhere. Dr. Maria, probably in a very briefly, yeah.
Yeah, for cervical spondylosis, at the end of the day, it's actually the exercise, no? The exercise and the job fitment in terms of what the employee could do and how much performance is needed in his workplace. So there's much to be said about job rotation, job fitness. So these are the things that
Recording stopped. Recording in
Okay.
progress.
All right, I think we can take another question. Last one. This is from Malaysia, Dr. Suhairul. How do you diagnose or medically confirm a work-related something of musculoskeletal disorders, right? Example like prolapse, PID, secondary to repetitive strain injury. That's one of the risk factors. So here they want to know how they want to diagnose this, whether it's related or not related to work, PID. Very briefly, Dr. Suhairul.
Okay, so basically there is no very specifically to diagnose on that one, but the main thing is must be very thoroughly on history itself. But history in occupational is very important. So you need to know what is the nature of the disease, what is the nature of the work related, basically, how they work, what is the job scope, when it's happened, and also any previously having a problem or injury before, or any like associate problem or any triggering factor, like example like smoking or something like that, that can cause further worsening of the diseases itself, or musculoskeletal problem. But the main thing, and then part of the history, and then second is the investigation itself. And example like if having PID, so definitely we need an MRI lah. So MRI of the spine can give supportive evidence apart from the history. But the thing is, but we need to very thorough in history taking. By history taking, we can conclude or can give most of the diagnosis itself. Okay, I think that's
Agree. So the occupational history is very important. I would agree, Dr. Suhairul. We allow 2 more questions. I think thanks to the organizer. Right. There's one question. This is about mental health. I'll leave it to the panelists or the speakers, whoever who can probably take up this question. We see a lot of mental issues such as depression and anxiety among the workers. As an occupational doctor, how actually we can manage the workplace in order to reduce the risk of mental? So these are the things that are common: ergonomic, respiratory, and mental health, right? So anyone?
I think one has to have a safe net, no? Meaning the employees should be able to express themselves. There has to be programs in place. As I've said earlier, there has to be a policy wherein each and every factor, inclusive of these health diseases, are in place so that the employees would have somewhere and something to look forward to in terms of the times that they need mental health, shall we say help. So as I said a while ago, there are psychosocial factors that needs to be addressed, and that has to be in the policy on how to address this. There is an interplay of the culture, the hierarchy of ranking, the openness of the organization, or in this place, the workplace, in terms of the employees being protected from such. One of the study had shown that it's actually the younger generation who are now what we call the Gen Z, Gen M, who are more prone to mental health issues. And it's actually the baby boomers who are stronger in terms of mental health. With all due respect to the participants and of course the reactors, this is one factor that has to be addressed as well in terms of workplace mental health. There has to be programs that has to be implemented for people to breathe, for workers to breathe. So there is what we call the mental health leave, just to be myself leave in some of the working places, especially in the Western part of our world.
Okay, thank you, Dr. Maria.
Yeah.
Right, Dr. Sunil, you want to?
Can I add? Yeah, I think mental health is a very important issue, and there are various forms of mental health issues. Depression, I think, is very, very common. I will just add on what Maria has said, and maybe there may be some overlap. So I think first thing is a regular open communication is very, very important between the managers and the employees to discuss about the work progress, what are the challenges, the well-being. And secondly, I think we need to have some virtual platforms such as online mental health screenings, self-assessment tools, and some education materials about, all these mental health issues. Then training for managers, because they should be able to recognize the signs of depression, and should be able to support their employees that way. Also, we should encourage social connections and flexible work arrangements, promote work-life balance. As Maria also mentioned very rightly, that we need to have some assistant programs, employee assistance program, and mental health benefits that provide access to some counseling services, therapy sessions, mental health professionals. So I think these are very, very important. And end of the day, we need to have a very supportive culture in the organization. We need to cultivate that employee does not develop, even if they develop mental health issues, we should be very sympathetic, empathetic, and try to discuss with them, and compassion. So mutual support among colleagues, and we should lead it by example by promoting a healthy work-life balance and prioritizing the mental health in decision making. That is important.
All right, Dr. Sunil. All right, very well explained by Dr. Maria and Sunil. Very last question. This is the really final one. I think I would like to ask Dr. Anna. This is about the work from home, right? Since working from home has become a popular work setup ever since pandemic, right?
Yeah.
So out of curiosity, there are a lot of common occupational health challenges for remote workers. What are some of the popular, probably you can share some of the popular programs or initiatives which is taken by probably in Philippines, Dr. Anna?
Yes. So actually, since work from home has already been starting even prior to the pandemic, though it was during the pandemic that work from home setup has really spread throughout the different workplaces that can do work from home. Some of the programs that our government stakeholders, such as the Department of Labor and Employment, has initiated is the department order with regards to prolonged sitting. So they have implemented on, but I believe together with Dr. Yamamoto in the Philippines, it is not just 2 hours, we want to actually encourage a change in position at least every hour. So through this webinar, we hope that we are also one of those who promote not just sitting down all the time for webinars, but also changing our positions every so often, so that we do not get your work related musculoskeletal disorders. Thank you.
So thank you. I mean, we all should go back to physical again.
Yes.
Conference, all that. All right. Thank you very, very much. Thank you so much to the to all the panelists, the speakers, and all that. I think we have come to the end of our webinar, and it was very fruitful. So today we have discussed about the importance of occupational health, particularly in identifying, managing, and preventing occupational diseases. Right. So today, the very important thing is we have bridged the gap between the occupational physician and the primary care physician, including other specialties as well, right? So it's important that we actively seek to bridge this gap. The workforce constitutes a significant part of the population, and with the aging population, we can expect that there will be an increased number of health issues to be addressed among older working people. So very important is both the occupation and non-occupational factors to determine an individual's health. A gentle reminder, you may also access the free online medical course by visiting the NIMS education platform as demonstrated on the screen. With that, thank you very much and goodbye. See you all again.
See you again. Goodbye.
Thank you.